We have a 43-year-old male patient who sustained a fall from a piece of industrial equipment today, approximately 2.5 metres tall.
It's now late afternoon, and Senior Emergency Dr. Sarah Whitelaw and her team are receiving a call from paramedics rushing to emergency with another man who's fallen, this time from a height at work.
At the moment, presenting in quite a lot of pain.
Room up and receive was in approximately 10 minutes.
They're not that far away, a few minutes, so we'll go into trauma 1. We'll draw up some ketamine. They say he's in lots of pain, so I think we should probably have that drawn up by the time it gets here.
The man landed on his feet, and Dr. Sarah and Nurse Maddie White know this kind of fall can be fatal.
If you fall from more than a couple of metres, you can have life-threatening injuries. Certainly, if people land on their feet, you can have broken heels and their lower back can absorb an enormous amount of force.
Ready, set, go. Ross was at work today. He was climbing off the back of a compactor, which was about between 1.5 and 2 metres tall, where he's lost his footing and he's landed on the ground on his feet, followed by a secondary strike to his bottom. He's got back up after a period of time, went back to work at about 8 o'clock when there were others at work. He was in another machine and he started to complain of some altered sensation in his feet.
Dr. Sarah needs to quickly find exactly where the 43-year-old's pain is coming from.
Whereabouts is most of your pain?
My lower back.
Okay.
My groin, my hips, ankles.
Okay.
Incredibly, Ross went back to work after the accident for 2 hours, and it wasn't until his workmates arrived that he was persuaded to go to hospital.
Just don't move your neck or your head at the moment. I'm just going to have a feel. Are you sore? That's really sore, isn't it? Okay.
Can you rate your pain out of 10?
When you move me, it's
10.
The team start a battery of tests: blood, ultrasound and x-rays.
I'm worried about injuries where Ross is complaining of pain, particularly in his pelvis and his groin and his legs. What I'm worried about is there a fracture in that area, particularly pelvic fractures that can be associated with huge blood loss and can be life-threatening.
I'm going to pop some cold goop on your belly and we'll have a look.
got a pain in my lower back.
Yeah, we're getting some pain relief for that right now. Deep breath in for me, mate. Deep breath in.
We're just going to put a collar on.
Hold your head nice and still, okay?
The ultrasound isn't showing any obvious injuries or bleeding to his abdomen.
X-ray.
But Ross's severe pain is pointing to a serious injury somewhere.
We are going to roll you onto your left side and examine your back. Just keep really still for us.
1, 2, 3.
Is that sore up the top of your back? Is that okay?
Yeah, there's pain down there.
That's pain, okay. All right, what about down here? Is that sore in there?
1, 2, 3.
Where, is that in your lower back?
Yeah.
Yeah, that's right there.
My groin. Oh, my groin.
Dr. Sarah Whitelaw and Nurse Maddie White are still trying to find the cause of Ross's excruciating pain. The landfill worker fell 2 metres off the back of compacting equipment, landing heavily on his feet.
It's what we call a decelerating force, which can cause injuries throughout the body, and certainly people can have life-threatening injuries.
Bring your toes towards your nose. That hurts your groin, does it? Okay, all right.
Dr. Sarah's worried the 43-year-old has massive internal bleeding.
If someone's complaining of a groin pain after a fall like that, there's bones at the front of the pelvis called the pubic rami. The pelvis is actually a bone in the body that essentially holds your spine and your legs together. If they're both broken, then sometimes the pelvis itself can kind of come apart. And there's big blood vessels that go alongside the bones, that when the bones get broken, sometimes they can shear the blood vessels, and you can certainly bleed to death from a pelvic fracture that way.
It's an incredibly frightening time for Ross. He's only just returned to Melbourne to help his mum after living in Canada for 18 years.
Must be a horrible day for you.
Oh, I didn't think it was that bad.
Yeah, I know. What happens after these sort of injuries is your body has natural adrenaline pumping around. So it masks a lot of your symptoms until you relax a little bit and realise what's happening. Adrenaline can make you do incredible things. People will do inhuman things, you know, lift cars off people. So I feel like Ross today, he's had this incredible trauma and then he just got up to do all the normal things, but then he's now realised he's in a bit of trouble.
Are you able to bend your knees?
They're bent, aren't they?
Okay. Does it feel the same on both sides?
I can't feel it on...
I'm really concerned about that lower back.
I know that if Ross has lower back fractures, it's really crucial that we get Ross comfortable enough to be able to stay still and make sure that that doesn't become a spinal injury that makes him into a paraplegic.
With his pelvis strapped to restrict movement, Dr. Sarah prepares pain medication so she can get on with the examination.
All right, darling, little sting, okay? Ready? 1, 2, 3. Doing very well.
Ketamine, it's a dissociated anaesthetic that you can give in pain, and it just takes your mind away from the actual injury and the pain itself.
But some patients react to the drug in unusual ways.
Just keep breathing, darling.
Ross is extremely agitated and he's not coping at all.
What the is going on?
You're all right. It's okay. Yeah, you're okay. You're in the hospital.
What the is going on?
Dr. Sarah Whitelaw's patient Ross is having a violent reaction to the pain-killing drug ketamine.
I'm scared.
Dr. Sarah gave the 43-year-old landfill worker the strong analgesic for his severe pain after he fell 2 metres from machinery, landing hard on his feet.
Sometimes they can see frightening things, they can feel like they're having a nightmare, they can feel agitated and stressed and anxious. So there's lots of things we can do to help with that. And one of those things that's really effective is just creating a bit of a calm, reassuring environment.
What happened to me?
You had a fall, mate. You
When?
had a fall. I think at work.
Ross, do your family at all?
Just... my sister.
Does your sister know you're in hospital today?
Oh,
So you're living on your own at the moment?
yeah, I've only been here 2 months.
Dr. Sarah still doesn't know what's causing Ross so much pain. She's very worried that the loss of feeling in his legs could be a spinal injury, which could cause paraplegia.
Oh,
I know, and you feel a bit awful.
oh, it hurts.
So they can get on with further tests, Sarah decides to give him fentanyl, a powerful painkiller.
I'm just going to give you, not the other stuff that I gave you. 20 mites.
You're okay, Ross.
The fentanyl works, and with Ross's pain finally under control, Dr. Sarah reviews his blood test results.
The other thing that worries me a little bit is this gentleman's blood count is quite low, much lower than we would expect.
And the x-rays reveal more bad news.
I'm worried about this gentleman's lower lumbar spine and what we call his sacrum. I'm going to organise a CT scan for you. I'm worried about something going on in your lower back and your pelvis.
His blood count is quite low, much lower than we would expect for a man of his age. So I'm really worried at the moment that Ross might be bleeding from a pelvic fracture, and we need to get a CT and work out if that's what's going on.
It's Ross trauma when?
In the CT scan room, the team move Ross gently to the machine.
We're gonna just slide you across, okay? Well done. Good job. Breathe. Ross, breathe.
There's obviously something going on. He's got a lot of pain, but what I'm looking for is big pelvic fractures or lots of bleeding from that area, or a big fracture of his lower back or an injury to the spinal cord.
Hey, Ross.
While Ross waits for the results of his scan, a workmate arrives to check in on him.
Pretty sore, huh? Yeah.
Has anyone got a call?
Oh, my sister, I was speak to me. He says... I'm worried about my pelvis, my lower back, because of the shock I felt, because I fell so high. Tell Mum it's all right. Yeah, love you.
Yeah, that looks chronic, doesn't it?
Ross's tests have uncovered an unusually low blood count, and his CT scan results are not what Dr. Sarah expected.
Ross is extraordinarily lucky. He's in a lot of pain, and that means that he's obviously got some bruising and soft tissue injuries, but he appears to have got away without any of the really big injuries that we were worried about. He does need to get his low hemoglobin followed up though, because it's lower than normal, and we need to go looking for why that might be.
You saw... That's really simple. Okay.
It was good news for Dr. Sarah and Nurse Maddie's patient Ross, who was cleared of any serious injuries after a fall at work that left him in severe pain.
Oh, my groin!
The 43-year-old landfill worker was kept overnight with suspected neuropraxia, a type of nerve injury which generally improves over a few hours.
With Ross, it was a good outcome. Every trauma is very different and could have been really, really bad, but Ross got lucky.
He went home the next day with painkillers for his soft tissue injuries.